thank you so much for inviting us to be a part of your program this afternoon, and thank you for your tremendous support of United Way. I also want to say happy anniversary. 100 years is a big milestone, so congratulations on your anniversary. At United Way, we'll be celebrating our 90th next year, and we're going through all kinds of old records and minutes, and Dallas Baby Camp was one of the first agencies to come together back in 1924 to form what is now the United Way of Metropolitan Dallas. So our history goes way, way back. And as you heard, you did really well in the United Way competitive grants process this year because your programs are outstanding. You received our largest combined award, so over 3 years, that's almost $3 million. But you also received the single largest individual grant, which is $1.5 million to My Children's Health Clinics. So congratulations. And I feel like I'm speaking to the choir when I tell you, this group, that your investments in United Way help us improve educational outcomes, making sure that our kids are graduating from high school ready for success beyond high school, making sure that families are getting the financial tools and resources that they need to be financially stable in this community, and that individuals and families are living healthier, more responsible lives. So thanks to your investments, we're able to make some significant outcomes, some significant progress in this community, and we have a 10-year plan to measure that over the next 10 years. The competitive grants process. Last year, we awarded over $30 million to 160 programs, investing in 103 agencies. 13 of those agencies were new because now we have an open and highly competitive grants process. So we're really excited about the programs that we invested in through that process, including your great programs at Children's Medical Center. But that's just one part of what we do at United Way. That's one part of our value proposition. We're doing so much more than just investing in programs through the competitive grants process. When we see gaps, we are building some of our own initiatives and programs, things like Destination Graduation and the Healthy Zone Schools initiative. We are involved in a lot of strategic partnerships and collaborations in the community. Charting the Course is our childhood obesity prevention collaborative, partnering with Children's Medical Center to see a significant decrease in the childhood obesity epidemic. We are also in the social innovation business. We've launched a social innovation fund, so we're now able to invest in new ideas with new organizations or import new programs to our community that are working well across the country. Advocacy is an important part of what we do, using our voice and having a community impact agenda that aligns with a public policy agenda. Volunteerism is critical to our work. Last year, we saw volunteerism increase 40% over the previous year from people in the community getting involved in United Way programs and days of caring. And measurement is a very important part of our value proposition, as all of you know. As business leaders, I know that you know the importance of evaluation, measurement, looking at metrics to chart progress over time, and we do too at United Way. But what's equally, if not more important than the measurement piece, is the human value of the work that we do in communities to make sure that everyone has an opportunity to be a contributing member of this region and that people have the opportunity to reach their fullest potential. I see it all the time, and I know that you do here at Children's Medical. There are thousands of kids who are bright and eager to learn. I saw a group of them on Tuesday when we kicked off our campaign with Live United Day at Mi Escuelita. Kids that are eager to learn with families who want them to learn and have the very best opportunities. I see thousands of people in our community who are looking for a hand up, not just a handout. And I see thousands of families that are looking for ways to live healthier, more responsible lives and looking for access to health care, which they're receiving through great programs like My Children's. So I know that there's not really a talent or a capacity deficit in our community when I see all these young people and I see all these families who are looking for a better life. I know there's not a talent or capacity deficit, but what there is an opportunity deficit. Because when those children don't have access to high quality early childhood education programs and their parents don't have access to the financial tools necessary to achieve financial stability or the health care necessary so that they can perform well at their jobs and their kids can perform well at school, if we don't have that, then we risk a loss of human capital in our region, in our community, that can never be replaced. And that's a loss as a community that we simply cannot afford. And that's where you come in. Your gifts, your time, your financial resources, your voice, you help us eliminate that opportunity deficit across the community for so many individuals, so many children, and so many families. So I want to thank you for your past support. It's been tremendous. It is a pleasure to call you a partner. It is a pleasure to invest in your programs that are making a tremendous difference across the community. And with your continued support, I'm confident that we're going to achieve these bold goals that we've set in the areas of education, income, and health. So thank you, and I hope that you have a very successful campaign, and I hope that you will give generously again to make Dallas and this region the best place to live, work, and raise families.